Hey, my name is Kaylee, and I'm in my first year of nursing school at the W. Throughout this year, I've learned how to auscultate heart, lung, and abdomen sounds, among many other things. But auscultate means to listen. So nurses or healthcare professionals, they use this thing called a stethoscope, and the stethoscope has two earpieces, tubing, and a diaphragm and a bell. The diaphragm, which is the bigger circular, is used to listen to high and low pitch sounds. The bell is used to listen to low pitch sounds. Normally you can hear everything with a diaphragm, but sometimes the abdomen sounds may be faint, so that's when you want to use your bell. To listen to heart sounds, you have 5 of them. They are the aortic, pulmonic, Irvis point, tricuspid, and medial. The aortic is on your right side between the second intercostal space. The pulmonic is on the left side between the second intercostal space. Then you have your Irvis point, which is where you hear the lub dub. Then you have your tricuspid, which is right where your rib cage starts, and then you have the medial, which is midclavicular line. So the nurse is going to listen to all 5 of those areas to listen to your heart sounds. Then she's going to go to your lung sounds, and she's going to place her stethoscope in 10 different places on the front side and the back side. She's going to start up under the clavicle and move side to side, going down in this motion until she reaches midline of your abdomen. Then she'll have the patient either sit up or turn around, and she's going to go on the back and do the exact same thing until she gets all the way to the middle of the back. Then she's going to have the patient lay down and listen to the abdomen sounds. And in the abdomen, you're going to go in a clockwise arrangement, and you're going to listen to all 4 quadrants, because you have your right upper and right lower quadrant, your left upper and left lower quadrant. And the nurse or healthcare professional is going to at least stay there for at least 2 minutes to make sure that he or she hears your abdomen sounds. So you're going to start here, and then here, here, and here. Normally you'll be able to hear like a gurgling sound, which is your the sound of your abdomens. That means they're functioning properly, your bowels are functioning properly, everything like that. Sometimes if you can't hear the abdomen sounds, you're going to use your bell. And so for this stethoscope, you just turn it and twist it till you have this open little hole right here, so that way it makes the sound that you can hear. You check heart, lungs, and abdomen sounds because it gives a good inkling of the patient's health, and it's like the big 3 is what we call them. So every time you go to the hospital or doctor's office or anything, a nurse or healthcare professional will listen to your heart sounds and lung sounds. And sometimes they may not do all 10 places for your lung sounds. They may not do all 5. It just depends on what they hear and what they think they need to do. That's really really important for nurses to do that, and it's just a great way for healthcare professional nurses to be with the patient and discuss their situation or anything like that. And you always do it with a physical assessment and everything like that. And so that's basically it. And I hope you learned how to properly auscultate your heart, lungs, and abdomen sounds. Thank you.